Hello. Today I will be talking about the genetic order that I have chosen, which is sickle cell. What is sickle cell disease? Well, it's an inherited blood disorder that affects red blood cells. Sickle cell disorder more commonly affects people of African, Mediterranean, and Middle Eastern descent. Also, in the United States, it mostly affects the African American community. Chromosomal abnormality. This is caused by a mutation in the hemoglobin beta gene, which is located on chromosome 11. It is a recessive genetic disease, so both parents must either have the sickle cell gene mutation or be a carrier with the mutation in order to pass it on to the offspring. This is a Punnett square chart for sickle cell disease. Double A represents a person with normal blood cells. Uppercase A and lowercase a represents a person that is a carrier for sickle cell disease. And two lowercase a's represents a person that has a sickle cell disease. I'm going to go over a few examples of these different scenarios. In a normal situation, both parents have dominant genes. The offspring produces 100% dominant genotype and phenotype. Sickle cell disease is not present in 100% of the offspring, once again under normal circumstances. In a carrier situation, in situation A, one parent has an large double A genotype, only dominant, and the other parent has a large A and small a genotype, one recessive and one dominant. Offspring produces 100% dominant genotype. 50% of the offspring has no sickle cell disease. 50% of the offspring are carriers. Carrier situation B. One parent has a 2 large A genotype, only dominant, and the other parent has an 2 small a genotype, only recessive. Offspring produces 100% dominant genotype. 100% of the offspring are carriers. Carrier situation C. One parent has a 1 large A, 1 small a genotype, 1 dominant and 1 recessive, and the other parent has an 1 large A, 1 small a genotype, 1 dominant and 1 recessive. Offspring produces 75% dominant genotype, 25% recessive genotype. 25% of the offspring has no sickle cell disease. 50% of offspring are carriers, and 25% of offspring has sickle cell disease. Abnormal situation A. Situation A, one parent has an 1 large A and 1 small a genotype, 1 dominant and 1 recessive, and the other parent has 1 large A, 1 small a genotype, 1 dominant and 1 recessive. Offspring produces 75% dominant genotype, 25% recessive genotype. 25% of offspring has no sickle cell disease. 50% of offspring are carriers, and 25% of offspring has sickle cell disease. Abnormal situation B. Both parents have a 2 small a genotype, both recessive. Offspring produces 100% recessive genotype. 100% of offspring has sickle cell disease. Based on this information, it's very important to get tested if you're a carrier and try not, if possible, have offspring with somebody else if you have sickle cell yourself with somebody else who also has sickle cell. Symptoms of red blood cells. Hemoglobin, the protein in which red blood cells that carries oxygen through the body, is negatively affected. Sickle cells are stiff, sticky, and normal and form a crescent shape. The cells stick together and do not move easily through blood vessels. This can cause blockages, which leads to other health problems. Symptoms of a person with sickle cell disease. Anemia, pain crisis, swelling of hands and feet, frequent infections, delay in growth or puberty, problems with vision, acute chest syndrome, splenic sequestration, jaundice, or stroke. Treatment. Medicine treatment reasons: to prevent the sickling of blood cells, to reduce pain crisis, to reduce risk of infection by penicillin. Medications prescribed: hydroxyurea, which reduces pain crisis, lessens acute chest syndrome, improves anemia, and decreases the need for transfusions. L-glutamine, oral powder, and crizanlizumab reduces frequency of pain crisis. Also, voxelotor improves blood flow and then lowers risk for anemia. There's also narcotics for pain relief. Other treatments include vaccinations, remaining up to date to prevent severe infections, intravenous fluids to prevent and treat pain crisis, folic acid to prevent anemia, blood transfusion to treat anemia and prevent stroke from occurring. Advanced treatment includes blood and bone marrow transplant, is the only cure for sickle cell disease. These treatments are only successful for some patients, typically children that have a matched donor. Due to the high risk, this treatment is reserved for only people that have severe symptoms. Researchers are looking into genetic therapy to find new treatments or a cure for sickle cell disease. Genetic therapy involves adding new genes or modifying existing genes. Here are a few references. Thank you for your time.